Good morning. This is Jean Eaton, your practical privacy coach and practice management mentor with Information Managers. Now, just a reminder, I'm not a lawyer and I don't play one on TV. These are my recommendations based on my experience and research and not legal advice. My clinic wants to use patient portals to allow patients access to their health information. Do you have any tips that you want to consider? Well, patient portals can be a great way to be able to provide patients information about their health information in your clinic. So it's a great way to be able to give patients access to tools like online booking, appointment reminders, test results, and more. Now, patient portals are functionality usually in your electronic medical record where patients have authorized access to your EMR so that they can access their own individual health information. Now, the access is controlled by the clinic, so you can select which patients have access to a patient portal, and you can select what information the patient has access to once they get into the portal. So depending on the type of services that you provide in your practice and the type of patient information and services that you provide, you can be a wide variety of things that you give patients access to. Now, you need to determine what is the purpose of you using the patient portal. And I strongly recommend that you don't give everybody access to the patient portal. It might be somebody that you give access to on a selected basis. So maybe it's for a particular program. If you have a nutrition and diet and exercise program in your clinic, maybe it makes sense to be able to give patients access to the patient portal so that they can upload their diary of information. If you're managing chronic disease patients, maybe it makes sense to give them access to their test results so they can be involved in the decisions about self-monitoring for their dosage for hypertensive drugs or diabetes, or a variety of other things. So if you start from a position of this is a privilege that you're going to provide to a limited few number of patients for very specific purposes, that will make it easier for you to be able to manage who has access to patient portal. Now, you might give everybody access to the patient portal so that they can see the office hours, find out more information about their family physician, and general preventative health articles and blogs and tips. And then you can further refine or role-based access to patients for individual sections of their patient health record. So you might include information that you're going to give to patients, and you can also allow patients to upload and add information to the EMR. Now, when you do that, you have to expect that patients are going to expect that their healthcare providers are actually going to be able to review that information. So you need to determine whether or not it's appropriate for your practice to do that. Now, it might even include access to articles of information that is especially for them. So if you can tag or segment your patients by the type of services that they're accessing in the health service clinic. So if you've got moms who have just recently delivered and had young babies at home, you might be able to upload information about common illnesses for infants and vaccine schedules and support for moms and dads. So you can customize the information in that patient portal depending on the EMR service and the functionality that you have. So patient portals is a great way to be able to share information with patients. But you also need to be really clear about what is the purpose of providing this. So it helps to improve communication with patients at their convenience. It helps to reduce workload for your front office staff. So maybe you're using it for confirming appointments and follow-up test results. And it's a great way to be able to provide supplemental information to the patient after their 5-minute visit with your healthcare provider. So there are many good reasons why you want to use patient portals. Now, I also want to be able to share the responsibility that you have as a healthcare provider to make sure that the patients know how to use this information appropriately. Now, we have a lot of studies about mobile devices and digital health, and it clearly indicates that patients want to have continued access to their information. It makes them more engaged in their healthcare process, and it helps them to be retain information after that patient appointment. Typically, when a patient comes to a clinic visit, they get a very limited few number of minutes with their healthcare provider, and there's lots of information, and then they leave the clinic and they forget about some of those key details. So it really does help to improve that communication process. But it is the responsibility of the custodian that is the owner of the EMR that's collecting the patient's information to tell the patient what the risks are of using patient portals. Now, because of the way that patient portals are set up, their security is usually pretty good within that system, but it's only as good as the weakest link. So you need to make sure that you have a patient acknowledgement, that the patient understands that there are risks and that these are the things that they need to do to be able to prevent those risks from happening. Now remember, this is a patient acknowledgement. It is not a get out of jail for free card. The custodian is still responsible for making sure that the technical and security and administrative safeguards are in place to make sure that there are appropriate risk and mitigation strategies whenever you implement new technology. And we'll come back to that in just a moment. So things that you want to be able to share with patients is tips for safe internet use. So the way the patients access the portal is by using a website browser to access in the EMR, and then there is a user ID and password typically to be able to access into that patient portal. So you need to make sure that you're telling patients what are the safe ways to be able to do that. So it includes things about not using public or shared machines. Don't have patients use their employer's machines or their employer's email accounts to be able to access the portal. It's really a problem for custodians when they share patients' information using their employer's information or the employer's assets, because now that patient's information is maintained, at least in part, on the employer's website servers and email accounts. So you don't want that to happen. You want to make sure that patients understand to clear their browser cache or use an incognito browser or a browser like DuckDuckGo that does not keep browser information stored in that browser. So there's no footprints left behind. And that's especially important if they need to use a public internet-enabled device like at the library or at the hotel. Use a private VPN. Don't use public Wi-Fi hotspots. Don't log in using their social media account, and make sure that you use a unique username and password to access the patient portal. So these are things that you need to make sure that you're telling your patients before you grant them access to the patient portal in your system. Now, if you've already got a previous PIA in place, and this is a new technology, a new initiative, a new project that you want to implement, you probably need to do a privacy impact assessment amendment. So you are changing your administrative procedures, your technology, equipment, services, or vendors. So those are all triggers for doing an amendment. You need to make sure that you have appropriate policies and procedures about how you're going to collect and use personal information that you are as part of the patient portal project. You need to do a risk assessment. What are the risks to the clinic and to the patient about how you're using this technology? And then make a determination about whether or not this is the right project for you to do. You need to make sure you've updated your policies and procedures about how you're going to implement patient portal in your practice. So have written procedures about how your staff are going to introduce and invite patients to use the patient portal. How are you going to record the patient acknowledgement? How are you going to update the information and let patients know what they have access to? All of that sort of thing needs to be done in your written policies and procedures, and you're going to include that in your privacy impact assessment amendment. So in your PIA amendment, typically it is less challenging than your original privacy impact assessment. And if you have an original PIA about your organizational management and you now want to do an amendment, I have a course that can help you with that. So this is the ideal situation for you to take this course, is when you've already got that organizational or that foundational privacy impact assessment, and now you just need to add the additional information for the amendment for this particular project. So if you'd like more information about the course, you can enter your questions in the membership on Rizuku, or go directly to the website informationmanagers.ca PIA-course, and you'll get the information about the course. And if you've got any more questions, send me an email and I'll be happy to let you know about that. So patient portals are a really great way to be able to share communication with patients, but it does require work to be able to implement them above and beyond just pushing the right buttons as far as the technology. So I want to thank you for your question about patient portals and encourage you to take a look at this as a way to be able to improve efficiencies in your practice, communication with your patients, and get good outcomes, but you need to do it the right way. This is Jean Eaton, your practice management mentor and practical privacy coach. If you like this episode, please subscribe to this channel and add your honest feedback to the comments below, so that people who like what you like can find this podcast.